And a very good Friday morning to you. Thanks for joining us here on News Talk WGAC. Bill Botham and the Augusta Business Review. Happy to welcome back Dr. Nicholas DeAngelo from the Augusta Pain Center. Good to see you again, Doc. Thanks for coming back by again.
Thank you.
Very, very happy to have you here. When you and I talked the last time, a couple of months ago, we pretty well established that the number one reason that people are coming out to Augusta Pain Center is back pain. There are plenty of reasons, but the overwhelming number one is back pain. I would like to take you down that path with some relatively generic questions, I think. But let's start with the simplest. What causes these back pains? What are we doing as humans that have us visiting you so much?
Well, we try to separate what's acute back pain versus chronic back pain. Acute back pain happens with majority of people nowadays, and it could just be a muscle strain when you're lifting up a heavy object off the ground and you're using inappropriate posture to actually lift, and you're therefore straining yourself, which is muscular, and you can pull a muscle just like you can pull a hamstring or groin muscle during a run or jog.
Sure, and that would be what you call acute back pain.
That'd be more of an acute back pain.
Okay, versus chronic.
Correct. Chronic, as we age, we're more likely to get chronic back pain. And chronic back pain can be due to multiple structures in the back, such as facet joints. These are the small joints up and down your spine, and those joints allow you to bend, twist, move. And so therefore you can get back pain in the back of your neck, you can get in the back of your thoracic spine or your chest area, or you can get it in the low part of your back, which is the most common. And those are pains usually what you notice when you're standing up, extending, twisting. Again, a lot of people know that when we get older, even when we get up out of a chair and try to make ourselves fully straight or even look up towards the ceiling, we start to feel that back pain as the joints come together and rub together. And those are probably the most common causes. Now, other structures in the back that can cause back pain, right below your belt line is the sacroiliac joints, the joints between your sacrum and your pelvis bone. And those are called the sacroiliac joints, and those can become arthritic as well. Then on top of that, then usually in younger patients, we can see disc tears or discogenic type of pain. So the discs are the cushions between the vertebrae, and if they get torn or there's a tear in them, they can develop back pain.
At what point should we be concerned? I mean, we stand up out of a chair, we stretch, we may hear a snap, crackle, or pop or something. Is there a way to know what's normal and when it's time to come visit you out at Augusta Pain Center?
Pain is a normal process, and that's what patients really are being educated about, that pain is a normal process of life. Everyone's going to have pain. Usually when it's a severe pain that is debilitating, or maybe they can't walk, maybe they can't function, they can't do their activities.
When it interferes with day-to-day life.
Correct. And then they should really start to seek somebody. Now, if someone just has a mild ache, meaning, this is just nagging at me, now those patients can come in to see somebody. You don't have to wait till it's to the point where you have to go to the emergency room. If you just have a small ache, you don't need to be sitting around dealing with that. That could be treated. And so a lot of patients will have back pain and do nothing about it because they're like, that's my arthritis. They know about it. But if medicines over the counter aren't working, Tylenol, ibuprofen, naproxen, those type of medications, then it's wise to go and get treated.
Get checked. Now, you mentioned the discs, which you said were the cushioning between the vertebrae, if I remember. I know the term herniated disc, and I've heard the term degenerative disc disease. Can you take us kind of through what each of those is?
Yes.
How they are similar or different?
We always make the analogy that a disc is like a jelly donut. There's a tough outer part called the annulus, and then there's a gooey inner part.
So it's a day-old jelly donut, tough on the outside.
Yeah,
okay.
There we go. That's even better. When you get a degenerative disc, the discs start to dry up. Just like as we get older, our skin gets dry.
Sure.
We lose moisture, and the same thing with the discs. And the discs can get desiccated or dry up.
Okay.
And that is a sign of just degenerative change. That is a normal process of life.
And the herniated disc?
A herniated disc can happen even to a young, healthy, normal, or even not even day-old jelly donut, maybe a fresh jelly donut, where you strain yourself when you're lifting something or doing something or jumping or high impact. When that jelly donut, that little gooey material inside the jelly donut pushes itself right through. So if you push on a jelly donut and you get some of the jelly to come through the side wall, that is a herniation.
So like any other hernia in the body, where it pushes through a side wall or a membrane?
Correct.
Okay.
Correct. And usually what happens is herniated discs tend not to cause back pain. A herniation is when you get the extrusion of that jelly and it touches or compresses the nerves in the back. And what the most common symptom of that is the pain in an extremity, and usually in your arm or your leg. Now, you don't necessarily get the back, what we call call back pain where it's around the level of your belt line, but more in the buttock. So when you get a herniated disc, it usually does not cause back pain. So patients think that I got a herniated disc, therefore I got back pain. Herniated discs usually cause buttock and leg pain because they are irritating the nerves. They're not necessarily mean that they're causing back pain. Now, a torn disc or where you have a tear may be enough to be causing discogenic pain, where it's almost like a rip in a jean, and every time you're bending and doing a certain activity, you're getting back pain. Usually, the rule of thumb is if you're getting back pain when you're bending forward, could be disc.
The spine controls everything. And in this case, you may feel the pain lower than that, as you said, in the buttocks or the legs, but it's a result of a problem with a disc in the spine.
Right.
Just another reason to drop by and give them a call out at the Augusta Pain Center. Dr. Nicholas DeAngelo with us. We're going to take a quick break. When we come back, we're going to talk about what your options are if you're feeling some of this, what the treatments might be, and the best way to approach that. Stay with us. We'll be back on News Talk WGAC. And welcome back into the Augusta Business Review. Bill Botham chatting with Dr. Nicholas DeAngelo from Augusta Pain Center on the web at AugustaPainCenter.com. You can call them locally, 706-738-7246. That's 738-7246. And doctor, just before we went into the break, we were talking about herniated discs and degenerative disc disease. Is surgery a good option? So what's the best way to pursue these or to seek treatments?
For back pain, surgery is not a good option to go right away. Really, surgical options need to be evaluated. However, majority of back pain can be treated conservatively and minimally invasive.
What would be treatments from conservative to most aggressive, I guess?
The initial treatment that conservative is physical therapy, modalities, chiropractic, core exercises. So those are kind of doing nothing and doing those at your home. Now, of course, most people go to anti-inflammatories and muscle relaxants. Muscle relaxants, especially if it's a strained muscle. Anti-inflammatories is anything for decreasing inflammation, or even Tylenol to decrease pain. Usually those are kind of the first initial conservative modalities.
And then beyond that?
After that, then we look, if you've kind of exhausted those kind of conservative treatments and the pain has been progressing, usually greater than 6 weeks and even longer than that, then we can start considering interventional type of procedures. And those procedures are usually done just with using a needle. Now, it's best to better diagnose that. So, of course, an X-ray is the most common diagnostic test that we do outside of an invasive diagnostic test.
What about diagnostic imaging?
Diagnostic imaging is an X-ray or MRI, CAT scan. Those are imaging things.
They all fall under that umbrella?
Correct. And the diagnostic is really just an X-ray. If you have back pain, a lot of patients want an MRI, but an MRI is not usually helpful for back pain unless there's going to be a rare, extremely rare tumor or metastatic lesion or cancer going into the back. And those are extremely rare and have a different presentation. Most of the time, you can pick up these structural issues with an X-ray. And even an X-ray when you're doing dynamic movements, such as bending forward and bending backward. And then we can see how the structures are, even with movement. After that, some patients do get MRIs, but usually, again, it's more to rule out anything that's more severe or what we call pathologic.
Sure.
Those are the cancers and rare things like that.
At what point in the treatment cycle, again, from conservative to aggressive, at what point do we turn to perhaps prescription medications as opposed to just the Tylenols and the over-the-counters?
When you come in for a visit, usually that's the first thing we'll do. Most physicians will get an X-ray, and then we'll start a prescription strength anti-inflammatory and prescription muscle relaxant. There's really no need to use pain medications, or what people say pain medications mean, the opioids, which are the hydrocodones, the Vicodins, the Percocets, the oxycodones, unless their patients are coming into a gurney, that they cannot even function or walk. So compared to, I just have pain, can I have something?
Again, that's on the rare side.
Correct.
What's the CDC saying about opioids these days?
Well, actually, the CDC is saying that we should be minimizing our use of opiates, and even for an acute pain, 3 days. And they have some vague language in there, no more than 7 days. But they're usually saying, prescribe for an acute pain for 3 days.
And the Augusta Pain Center, you try and stay away from those. You mentioned that's at the end of the list, unless they, as you see your term, come in on a gurney. I like that.
Yeah, and those are people that really cannot even stand up
Sure.
or go to the bathroom or be able to do their normal activities. And so that's why we try to minimize that. But when you come in, you get an X-ray, prescription strength anti-inflammatories, and muscle relaxants to start the ball rolling. If they haven't done any therapy or physical therapy, we'll initiate that. After the examination, we can hone in and see what kind of structures. Is it coming from the facet joints? Is it coming from the discs? Is it coming from a nerve? Is it coming from the joints? the SI joint. So we can better evaluate that through an evaluation. And then after that, then we would schedule patients for diagnostic testing. So we're then using a needle to place local anesthetics or numbing medicines and being able to identify what structure is causing the back. Because all those structures are so close to each other, we have to be able to better identify what structures are in order to treat it.
And be very specific in doing so.
Correct.
Sure. All right, it's Dr. Nicholas DeAngelo, Augusta Pain Center, located where, sir?
1324 Interstate Parkway. It's right off of I-20. You can see it off of I-20 and
by Doctor's Hospital, right?
Over near Doctor's Hospital, yes.
All right, on the web at AugustaPainCenter.com. Local telephone number 706-738-7246. 738-7246. All the information and more available at AugustaPainCenter.com. Thanks for breaking it down for us. I really appreciate that.
Thank you.
Really appreciate that.
Thank you.